Here's another nice case. It's called liver lymph node hemochromatosis / hemosiderosis. Well, we already learned the difference between chromatosis and siderosis, so just look at some more cases. Here's a liver. It is kind of brownish. Here's one that's a lot browner than this one. And here's a cut section of it as well. I believe these are, no, let me take that back. These are lymph nodes above it. Here's a normal lymph node. Here's a lymph node that's browner than it should be. Here's a normal liver, and here's a liver that's browner than it should be. And why is it browner than it should be? Well, in the case of the liver, it's browner because when you cut through it, you could see that all, if not most or many, of these hepatocytes are just loaded with iron or hemosiderin form of iron. I think you can also agree that there's a lot of irregular bands of fibrous tissue between these nodules. This is clearly a cirrhosis, and it is a cirrhosis secondary to iron overload disease, which is called hemochromatosis. Look at all of these brownish granular hemosiderin granules within the hepatocytes. Let's look at the other slide. If you remember, there was a lymph node that was with that too. I think I can convince you this is a normal lymph node. And I think we can see follicles. I think we could even see a very nice subcapsular sinus with follicles underneath. But notice that in the portion of this lymph node, which is usually rich in macrophages or histiocytes, for example, this area is predominantly a lymphoid follicle, and lymphocytes are not supposed to gobble up iron because they don't have macrophagic or phagocytic properties like the macrophages do. But in the areas of the sinusoids, which are very, very rich in iron macrophagic gobbling cells, that they're just loaded with iron as well. So even though the overall architecture of this lymph node is relatively preserved, in that you can recognize it as a lymph node with a capsule, a subcapsular sinus, follicles, and then medullary cords and sinuses on the inside. All of the areas which normally have macrophages are just loaded with iron. This is a very nice case too. This is hemochromatosis / hemosiderosis.